All right, hello everyone. I'm Dr. Markmann. I'm a board-certified plastic surgeon.
Hi everyone, it's Brittany, nurse practitioner. We just want to thank everybody on the front line, healthcare providers, and everyone that's helping the country through this really hard time. We know that it's really challenging, but we will get through this.
So stay home and stay safe, and hopefully we'll see you out there soon.
I believe that this has been life-changing and it exceeded my expectations.
I'm Dr. Markmann. And you're Alice.
I am. Hi, Dr. Markmann.
Nice to meet you. Sorry about the phone there.
Not at all.
And what are we seeing you for today?
So I've been working on my husband for about a dozen years to do breast augmentation surgery.
Okay.
Because I've always been unhappy about my breasts. I mean, even when I was in my 20s, I thought, oh, I'm going to have breast augmentation surgery because, I was just so small, And
Okay.
Anyway, after I married my husband, and he's always been saying, you look perfect, I love you the way you are, which is wonderful and everything. But I wanted to at least wait until I got done nursing babies, and I have 7 children that I nursed to 13 months. So except for my youngest, I nursed him to 14 months.
That's a lot of years of nursing.
Yeah. And I feel like they took everything out of me.
Sure.
So my breast fat tissue has shrunk, I feel like to microscopic levels. And
Okay.
anyway, it's very embarrassing to talk about, and very it makes me very unhappy, and I just don't like how I look. I feel like I look disfigured. I feel like I look disformed, and so whatever you see is because I had to stuff my bras, and that
Sure.
type of thing.
Sure. So it's something you wanted for a long time.
Yes.
Okay.
Yeah.
And you're done having children now?
Oh yeah. My youngest is 14.
So I don't want to start over again.
Right.
Okay.
Right.
Some women do this before getting pregnant or before having babies. Other women do it afterwards. So some women just naturally never have much in the way of breast tissue. And then there are those who have it, and with breastfeeding, sometimes it goes away. So we see it on both ends of the scale, but usually if you're in the midst of having kids, there's no point doing it right then.
Right.
So usually I recommend either before or after. You can do it any time, but usually there's the best times. So breast augmentation, basically, we have 2 basic types of implants. There's saline implants. Salaline's what we had to use from 1990 until about 2006 because silicone was off the market at the time. Since then, since 2006, silicone's been put back in the market, and that's probably about 99.9% of the implants we use these days. So salaline's still available, but it doesn't feel as natural, doesn't look as natural, and it ruptures more commonly. So typically, silicone's going to be a better implant. Implants, as you see from our collage of implants over here, we have numerous different sizes. They go from very small, of about 200 cc's for an implant, up to about 700 cc's. So all different shapes and sizes, different profiles, which will allow us to find a good size that fits you. Can make it pretty much any size you want due to the different profiles of implants these days. So what size bra do you wear right now?
So,
Do you wear a bra?
yes, because I have to make
for the
myself
cover.
look somewhat normal, because if I didn't, it would be very sad. And yeah, I tell my husband, well, my husband sees me. He goes, when I go to the water, when I go to the beach and stuff, and
Sure.
I don't go in the water. I don't go when I'm in the pool. I don't go in the water. I might get my feet wet or whatever.
And why is that?
Well, I'm afraid that something might float away, or my bathing suit might, reveal too much that, and it would
Sure.
just, somebody on the beach would be looking at me going, oh, look at that poor woman, she has no breath.
And how big do you think you want to be?
Larger than what I am. Anything
that's easy.
larger would be an improvement. I would love to feel very beautiful. I'd love to feel very feminine. Considering we're kind of starting at zero, we're going to have probably a larger size.
And that's
I think.
typically the way it works with women even women who have mastectomies, because they've got nothing left, usually require a bigger implant to give them a reasonable size. So if you're starting off with nothing, which we see women like that all the time, who've got no breast tissue at all or almost nothing at all, they tend to require a bigger implant.
Okay.
So if you're starting off with a C cup, you want to go up a little bit, kind of a small to moderate implant. But if you're starting off with A or double A, then typically it's going to require a bigger implant to give you what it sounds like you're looking for.
Will mammograms still be needed?
Yes. Everybody with or without implants over the age of 40 should get a mammogram. Yes.
Okay.
Yep.
And how is that done? Like, do you just, I don't know. I mean, mammograms, they squeeze the tissue down. So if the implant's there, how does that work?
Well, first of all, the implant we typically put behind the muscle. So when they're putting your breast in the mammogram, it's just getting your breast tissue and the fat and breast glandular tissue on top of your muscle. So the implant doesn't change that. I mean, sometimes they might need to take an extra picture or two to see all the way around the implant. But still, it's still the same mammogram, same type of pictures. If anything, having the implant behind the muscle pushes all your breast tissue out, which makes it a little bit easier to get a mammogram sometimes.
Okay. Also, would it be better to remove the remaining breast tissue and just have the implant, and then you don't ever have to worry about breast cancer?
Unfortunately, you can really never remove all the breast tissue,
Oh.
or at least there's always fear of leaving some behind.
I see.
So it really, and whether you have 10% of what you have or 100% of what you have, either way, you still got about a 1 out of 8 chance of getting breast cancer.
Okay.
So you still should do mammograms. You should still do self-examinations on a monthly basis. And many women find it even easier to examine when you have implants, because now you're feeling across a smooth background as opposed to lumpy ribs.
That makes sense.
There are even a few studies that show that women with implants find their cancer at an earlier stage if they do develop a cancer. But there's no increased risk of getting cancer from having implants.
So they discover possible lumps because they're constantly or every day having to do some sort of...
Correct. So we recommend massaging your implants once a day for life. So typically women with breast implants are a little more in tune to their breasts. They're constantly feeling them every day. So they do tend to find cancers at an earlier stage if they develop cancer. Yes.
And why do you have to continue to do that breast manipulation every day?
Okay. So again, every implant you put into a person's body, whether it's a chin implant, cheek implant, heart valve, anything foreign we put inside of you, your body just forms a balloon of scar tissue around the implant.
I see.
So that scar tissue, we want the pocket to be as big as the implant or a little bigger so the implant can move around inside. If that scar tissue starts to shrink around the implant, it makes the implant feel hard, makes them look very round, tends to push them up a little bit. So
That's not a great look.
right. So you want to keep it looking good, and you want to keep it feeling natural as well. And the best thing to do is just move them around every day, give them a little squeeze just to keep that scar tissue stretched.
Okay. And then how long do they last?
So all the implants come with a lifetime warranty.
Okay.
There are 3 companies that make implants. All 3 of them give you a lifetime warranty. If it ruptures any time in your lifetime, they'll give you a free implant to change it. If you go into the OR, you want to change them both because they're all, they're 20, 30, 40 years old or whatever, or any time, you can change them both. They'll give you 2 free implants. That actually allows you to change size as well. So if you go into the OR, if you want to change them, you can go up or down in size at the same time.
And how difficult is that to do?
Very quick and easy. So, implants, as long as it's maintained within your capsule, if it was to rupture, we just open up your scar, remove it, and put a new one in.
Okay.
Walking a mile in our patient's shoes is something that all of my employees do.
How would I know if it ruptured?
It takes a lot of force to rupture an implant. So you can throw them against the wall, you can step on them. There's even a video of a doctor putting in front of the tire of his car and running over it. It flattens it like a pancake and comes right back together. So they're very durable nowadays. They can rupture, but we don't expect them to rupture for a long time. And as I did mention to you, the lifetime warranty
Right.
for replacement of the implants. Plus, if it was to rupture in the first 20 years, the company that I work with gives you $5,000 plus the free implants. So they expect them to last you at least 20 years.
Okay.
And if it was to rupture, how would you know? If you were in a car accident or something and hit the steering wheel, there's a chance that it could rupture from that, or a major fall. But typically, you're not going to know if it ruptures. And again, the number one cause of ruptures is just old age of the implant. If you got a fold in the implant where it's moving back and forth like that, it's where it's eventually going to rupture. So we call it a silent rupture because you never know that it happens. And most people never have any signs or symptoms or any problems, even if it did happen. But if we know that it's ruptured, we recommend we change the implants for sure.
I thought about one more thing you were talking about before, and that is the keeping your arms down by your side. So you're kind of going to be on pain medication, right? You're going to remember to do, keep your arms down.
Yep. So a lot of people do have that issue. They're taking a lot of pain pills afterwards, and they don't realize that they're moving around more than they should. In which case, many husbands or patients themselves strap their arms to their side. They can take the belt off of a robe or something, or use an ace bandage, or even take a t-shirt and pull it over top of your head and arms just to remind you not to move.
Okay.
Because a lot of people taking the pain pills don't remember what they're doing.
Because I really don't think it would be attractive to have them.
Especially not lopsided. That would not be good.
Well, thank you.
Okay.
You've answered all my questions.
Very good.
Thanks.
Well, thanks for coming here. Let's examine you next. We'll get a better idea of what
Okay.
you're starting off with. And we also do something called Vectra imaging. Vectra is a 3D imaging system. It takes pictures of your body from all different angles. Then the computer puts them back together into a 3D image. The computer will make your breast bigger with any size implant you want, and it's 99.9% accurate. Whatever you see in the computer is what you're going to get. So we'll do that next as well.
Okay.
Okay?
Sounds good.
All right, very good.
Like I said, that's the best improvement.
Yeah, that looks nice.
I'd be very happy.
It's a good size for you, nice proportions.
Right.
You can see bigger or smaller, is up to you.
Well, let's go bigger.
A little bigger?
Yeah.
Okay. So
Because if I'm going to do this, I might as well,
definitely, might as well go all the way, huh?
see,
So here you are with
what
the,
our potential is.
yep, so here you are with bikini on. So it shows you big change
Yeah.
from before. Anything else you want to see? Bigger, smaller? So this is you with 500, this is you with 700.
So since I'm starting out with such a small amount in the first place, I'm leaning toward the largest that you got up there.
Okay.
Just, I've had enough time of being really little. I think it'd be great to have time to be really large.
Were you ever that size when you're breastfeeding?
I don't think so.
No, not quite that size. Well, it looks beautiful.
Maybe
so.
maybe the middle.
Middle one. Okay.
Yeah.
Well, that looks nice.
Yeah.
So go with 700. That's the plan.
Absolutely, yeah.
All right. Very good.
Walking a mile in our patient's shoes is something that all of my employees do.
Any other questions from you about anything?
No, I can't think of any off the top of my head right now.
Okay.
Just that, it's
Time to do it.
it's going to be really a nice, wonderful change for me.
Awesome. It definitely will.
Because it's so difficult for me to, feel comfortable around other people, especially
Sure.
when you were first examining me. I just started crying because it's very embarrassing.
Sure.
It's very embarrassing. And
Well, this will be life-changing for you.
yeah,
It really will.
it'll be wonderful.
You're going to love it.
Yeah, thank you so
Well, very
much
good.
for being willing to do it.
Definitely will.
Because it's so difficult for me to, feel comfortable around other I'll be 5 weeks tomorrow. So I was, I actually got my implants done on Valentine's Day. I believe that this has been life-changing and it exceeded my expectations. And I have to say that in like 6 months from now down the road, it's going to be even better, because not only am I going to feel stronger and not have the pain that I've been experiencing, but everything's going to calm down, and they're going to be like the perfect shape, you know. So like, because right now that everything's kind of swollen and still irritated and everything. So, but it looks good. We're good. He's the one who helped encourage me with the size of the implant, the shape of the implant, implants, I should say. And yeah, so I mean, he was very encouraging, and I needed the encouragement, because, you know, I could have just as easily maybe thought about running out the door, but since he was so wonderful, and he was very sweet and gentle and understanding, and just willing to answer every question. I came in with like a notepad, a notebook, with like a list of questions, and he answered every single one of them, and I just was very grateful for his abilities and his capabilities, his whole his education and his expertise, but that he's very kind.
Hi, I'm Scarlett, medical esthetician for Metamorphosis Plastic Surgery. Since the show aired a few weeks ago, we actually had a really wonderful response. And ever since the show aired, we discovered that we are no longer being able to see patients here. However, we are still taking online consultations. We are communicating with people over email, over telephone, and we're doing video conferences that we are able to still communicate with our patients. I am going to invite you into my little world today. I'm going to do an online consultation with a brand new patient. She reached out to me a few days ago, and we scheduled the appointment to do it today. So I would love for you to see what it is that an online consultation entails. We've been very blessed since the show aired that we've had some really great responses. People's interests have peaked, and what we've discovered is that right now is an excellent time where people are taking the time to think about themselves, take care of themselves, their family, and really focus on what's important. And a lot of them are taking turns or taking the time to really look at what it is important for them and how they should be taking care of themselves. I think most of us are usually running around trying to get things done. And now this time of break in the midst of some sadness as well is giving us the opportunity to take care of ourselves. So we're still working, we're still communicating with people from home, and we are able to reach out to you via technology, which is fantastic. So I'm going to go ahead and invite you to join me for my consultation with my next patient. Thanks for doing the consult with me today online. All right, so we're going to go ahead and do this consultation. I'll answer your questions, anything you want to tell me. We'll just kind of go through as if you and I are standing in front of each other, okay? Okay, so you wash your face every night, and then you use a moisturizer. And so that to me is number one, because you already have some form of routine established. We just have to add a couple more things in there to kind of make it right. So your goal is to get rid of that dry skin, if I understand correctly, to reduce the puffiness in your eyes and the pores, the size of the pores that you have, and then some pigmentation around the chin area. Okay. All right. So I'm going to put that down. So here's what we're going to do. So what's happening is, as we get older, we need to start really taking care of our skin differently. And the skin we had when we were younger that was really resilient, and you could go to bed and not wash your face after you came home from the club, and then you wake up and you kick it back on and you still look good, that's no longer an option anymore. So, and I think just with everybody, we all should just be doing that in general anyway. But so you don't need 20 or 12 products to use. You want to keep it simple. You need a good cleanser, a toner. A toner is important to kind of correct the pH in your skin, because when you're washing your face, you're changing the alkalinity in your skin. So there's a pH scale that goes from 0 to 14, 0 being acid. So lemon is a 2 or a 1. Okay, so it's really acidic. So if you put lemon on your face, it's going to burn. Well, when you go up the scale, it goes up to alkaline, and you're talking about lye, like cleaners and things like that. Your skin sweet spot is a 4.5 on that scale. Water is a 7. So even water alone is really harsh on your skin by itself. So yeah, so when you wash your face, you're bringing that alkalinity up that scale so that the pores can open and they can release the dirt. But if you don't close them back up, you're kind of leaving your skin exposed to bacteria. So you want to use a toner to bring it back down. Your skin should be slightly acidic and slightly wet. Okay, so not greasy or oily, but just have that nice dewy. And you might not get that from today till tomorrow, but over time you will get that if we start to correct the pH. What happens is a lot of the times people switch up products and they use different things, and it changes the pH in your skin, and so you start to experience a lot of the dryness. Because as I'm looking, you don't seem to have dry skin. It's probably dehydrated, and it's getting dry because of some environmental factors. There's sun damage out there too, as well as you using something that's going to be too strong for your skin. I don't know if you're familiar with linseed oil, but that's what I use to clean my brushes, and is more of like a paint thinner type of thing. So that's, you feel that strength. So yeah, so it's really strong. Turn the label around and you'll be able to see, like in the back, it should be able to tell you the type of ingredients that are in there. So without scaring you too much, that is where you want that your skin to be at that sweet spot, which is the 4.5 pH. And you've heard of pH, right? You balance the pH and you go up and down. You want to make sure you keep it there, so you're going to use products that are going to make sure that are going to stay within the range of where you're trying to accomplish. So an exfoliator, a scrub will come in and remove that dead skin that sits on the surface. And sometimes that dryness is as a result of dead skin that sits on the surface. So you use a good system at home, but then you also come in and you can do some facials. And I know that you had expressed before possibly doing some facials. Have you had facials before?
Never, no.
No? Oh, great. Okay, well, I love facial virgins. It's great because then you discover what's really good for your skin. The great thing about facials is that I don't consider them a luxury. They really are a necessity. They're kind of like when you go through a car wash. Really, you're kind of removing that top layer of that skin, and then all your products are going to penetrate much better into that layer of the skin. So you'll have much better results after you get a facial. I do hydrofacials, which is a hydrating facial. It exfoliates the skin. We use a salicylic peel in it to remove that top layer. Once you remove the dead skin on the surface, your product's going to penetrate better, and then they're going to start going deeper and deeper. And then once we get establish a routine of regular, then we can go in and use specialty products, such as like a spot treatment for the areas that you have pigmentation.